I guess this kind of started when I first started training, and I was looking at ways I could, get some more time literally in the training room without being in that room physically. So I had an interest in, design and a bit of gaming and computer software. So I decided to kind of make a virtual environment of the radiation oncology clinic, and then kind of went from there.
Technology is completely revolutionising how we do our education. Virtual reality is one of the tools in it, but it's a really amazing tool which gives us the ability to give people access to scenarios and to environments that would be very difficult for them to access otherwise. So for instance, if you have a CT machine or you have a radiotherapy machine, it's difficult to get time on those machines for people to sit around and be able to play around. What does each individual button do? But in the setting of virtual reality, students will be able to have as much time as they want to really explore and understand how those machines work. What this is replacing in some instances is people reading something from a textbook. And you can imagine that it's very hard to get a truer experience or learn something out of a textbook. So the immersion aspect's one. And the other is, like you say, it's that accessibility. So you could be 10 o'clock at night in your own home and you're able to spend time learning this material.
I guess one of the things that has stemmed out of this was after we created the CT environment, we thought it would be a great opportunity to then allow maybe patients or students to actually see what it's like to have a CT done in the real world setting. So what you can do is you can visualise the patient having a CT done with a head and neck mask over them, and then you can actually experience having that same procedure in real time. One of the applications we will be launching or a study on very soon will be the head and neck virtual reality study. And we're hoping to alleviate anxiety and claustrophobia in head and neck cancer patients who come in and have a thermoplastic mask made over them. We hope that will, give them a bit more, educate them and relieve a bit of that anxiety and claustrophobia of not knowing what's going to happen. I guess once the study is complete, and hope if we get some good data, some good results, we certainly hope that we can use it as a tool, across Victoria and maybe even Australia, as a tool to educate patients and alleviate the anxiety and claustrophobia.